Hello! If you're a parent and you've been feeling that knot of worry about your child's hearing, or you're just tired of those endless earaches, you have come to the right place. We're going to walk through everything you need to know about a very common condition called glue ear and the simple, effective surgery that can fix it. This is all about helping you feel confident and clear about the path forward.
It's totally normal to be worried. I mean, you might have noticed your child isn't turning when you call their name, or maybe their speech seems a little behind, or maybe they're just always pulling at their ears. These are the exact signs that bring parents like you looking for answers. And today, we're going to get you those answers. So, let's start with the basics. What in the world is glue ear? Well, the fancy medical name is otitis media with effusion. But honestly, glue ear describes it perfectly. It's when this sticky, glue-like gunk gets trapped behind the eardrum. It's super common in kids, and it's not your fault. It's just anatomy. You see, their little drainage tubes in their ears, the eustachian tubes, are flatter than ours. So after a cold or an allergy flare-up, they can get blocked easily, and that fluid has nowhere to go. And when that fluid is trapped, it causes a bunch of problems. For your child, it can make the world sound muffled, almost like they're hearing everything from underwater. And as you can imagine, if you can't hear clearly, it's really hard to learn to speak and keep up in school. Plus, it just feels yucky, a constant feeling of pressure or fullness. And worse, it can lead to one painful ear infection after another. Okay, so that's the problem. The good news? There's a fantastic solution. But before we even get into the what, let's talk about the who. Because when it comes to your child, knowing they are in the absolute best hands is everything. So let's meet the expert surgeon who will be looking after them. Your child's surgeon is Professor Dr. Ahmed Nofal. He's not just an ENT consultant. He is the head of the ENT department at Reem Hospital in Abu Dhabi. Now look at those credentials. He's a fellow of the Royal College of Surgeons of Edinburgh. That is a huge deal. It's a world-renowned standard for surgical excellence. His entire specialty is focused on exactly what your child needs: pediatric ENT and incredibly precise microscopic ear surgery. And let's talk experience, because that's what really brings peace of mind, right? Professor Nofal has performed over 4,000 advanced surgical procedures. Just think about that number. That's thousands of children and families he has helped. That is an incredible depth of expertise that will be dedicated entirely to your child's well-being on surgery day. So what this all boils down to is really simple. Your child isn't just getting a standard procedure. They are being cared for by a globally recognized leader in this field. That's the kind of reassurance that lets you take a deep breath and know everything is going to be okay. So now that you know who's in charge, let's look at the solution itself. It's a procedure involving something called a grommet, and the best words to describe it are quick, safe, and incredibly effective at solving the whole glue ear problem once and for all. So how does a tiny grommet fix such a big problem? Well, this explains it perfectly. On the left, you see the issue we've been talking about, that blocked tube trapping all that fluid. On the right, you see the solution. The grommet is basically a tiny temporary ventilation tube. It creates a little bypass that lets air get back into the middle ear. And, this is the magic part, it lets all that trapped fluid finally drain out. Problem solved. And you know what's amazing? The whole thing usually takes only about 15 minutes. Seriously, your child will be completely and comfortably asleep under general anesthesia the entire time. Professor Nofal makes a microscopic incision in the eardrum, gently suctions out all that sticky fluid, and then pops the tiny grommet into place. It's over before you know it. And here's something really important for parents to know. This is not a permanent implant. The grommet just stays in place for about 6 to 12 months. It does its job of keeping the ear aired out while the body's natural drainage tube heals and matures. Then, as the eardrum repairs itself, it just naturally pushes the grommet out all on its own. All right, let's shift gears and talk about what you can do to get ready. A little bit of prep makes the day of surgery so much less stressful for you and for your child. Here are the big things to remember. The fasting rules are absolutely crucial for safety with the anesthesia. So no food for 8 hours before and no water for 2. Super important. Also, make sure you tell the doctor about any and all medications your child is taking. And then there are the comfort items. Don't forget that favorite teddy bear or special blanket. And dressing them in loose, comfy PJs or sweats just makes the whole day feel a lot cozier. So the 15-minute procedure is done. What's next? Well, I think you'll be pleasantly surprised by how quick and easy the recovery usually is. Let's take a look at the timeline.
So, right after the surgery, your child will be monitored for a little while in the recovery area, but you'll get to go home that very same day. And get this, most kids feel totally fine to go back to school or daycare the very next day. You might see a little bit of fluid from the ear, which is completely normal. And after that, you just let the grommet do its thing until it falls out on its own months down the line.
Okay, your job after surgery is pretty simple, but there is one golden rule. You have to keep the ears dry. Because the grommet is an open tube, you don't want water getting in. So that means using earplugs for baths and swimming. If there's any discomfort, simple pain relief like you'd use for a headache usually does the trick. And please never stick a cotton bud or Q-tip in the ear. It can cause a lot of problems.
Now, while problems are very rare, you should always know what to watch for. Give the doctor a call if your child gets a high temperature, if they have ear pain that just isn't getting better with the pain relief, or if you see any discharge that looks unusual, smells bad, or seems like a lot. Those are the main things to keep an eye on.
You know, it's one thing to have a world-class surgeon, but it's another to have that care delivered in a top-notch facility. The entire team and the hospital itself are all focused on making sure your child is safe and that you feel supported from the moment you walk in. And that brings us to the final point, which might just be the most important. Your child looks to you for cues. Your calm and your confidence will be their calm and confidence. Just keep reassuring them that this little procedure is going to help them feel so much better, to hear the birds sing again, and to get back to the wonderful business of just being a kid. That's the best medicine you can give them.